Good afternoon, all of you. Today, my name is Harpreet Gupta and I'm an ICI student. I'm here to talk about anatomy and physiology. But today, I'm especially here to teach you about this skeleton system, all the bones. So it's very hard to remember each and every bone. But in order to review about the bones and to pass out our tests and our quizzes, so we have to learn. But I am just going to tell you the easy method to learn, so you will be able to learn. So don't worry about that. But what exactly anatomy is? Anatomy is study of the structures like heart. If we don't know where it is located, it is on the left side or it is on the right side. So how we will learn about the heart or cardiovascular system? So let's start with the brain, this one. So this is the frontal bone. You know what is the frontal? It is in the front. And this is my favorite bone, and we always use this bone. Like whenever I'm sitting in the examination hall and I don't know the answer of the question, so I always put my hand here. So this is the using of frontal bone. So this is your frontal bone, and after that, this you know is your nose, smelling nose. So this is nasal bone, and this one your cheeks. So it is zygomatic bone, and then we come maxilla. Here is maxillary bone, and this one, it is very easy to remember this name. It is mandible. But I'll just give you one example. Like when your tooth aches, you always hold it. That is paining. So this is mandible. Let's review. What is this bone? Can you tell me? Here, I've told you that it is in front and we always use it. So this is starting with F letter, frontal. And what about this one? It is very easy to remember. It starts with N letter. This one, what exactly this is? Nose. It means nasal bone. And this one, which is zygomatic. And what this one, this bone? It is maxilla. Can you tell me the name of this bone? Any one of you, it is very easy to remember. This one, what exactly this is? I've given you example also. This is mandible. After that, we just come here. You always wear shirts. So what exactly this one? It is the collar. So this is collarbone. And it is also known as, it is clavicle. So it is clavicle, and it is also known as collarbone. So easy to remember. You always wear shirts. After that, so this one is manubrium. After that, this bone is sternum. It is also known as breastbone. It is located here in the center. And this is the third process. After that, there are so many ribs. So we have to remember these. These are the true ribs which are attached to the sternum. And these two ribs, these two pairs are false ribs. And these two, you can see, they are floating. They are not attached to anyone. They are hanging. It means they are floating ribs. So let's study. But can you answer this question of mine? How many bones are total in our body? What exactly we real are? So can you tell me, like, how many bones are in total? Any one of you? Just a guess. There are 206 bones. Wow, there are so many bones in our body and we don't know. Let's review again. This is starts with C. It's a collarbone. So what exactly this is? It is clavicle. And what about this one? It is starts with M. This here is manubrium. And what about this one? I told you this is the breastbone here. So what you call it? What's the name of it? It is here. This is manubrium. This is breastbone. It is also called sternum. And this one is the little one, sweat process. And these are the true ribs. True. They are attached to the sternum. So they are the thing. They are called true ribs. And these one false ribs. And these are the floating, which are hanging, no place to join. So these are called floating ribs. And what about this thing? This is vertebral column. Then we come to pubic. But then the question arises, like male skeleton and female skeleton, they both are the same. What is the logic behind it? Everyone thinks, oh yeah, they are the same. But logically, they both are not the same. Like male, it is bigger. Skeleton is bigger. But the female skeleton is shorter as compared to male skeleton. And even the pubic inlet for the male, it is very deep and shallow. But the female outlet, you can say it is wider. You know what is the logic behind it? Like why it is wider? Because the baby head, you know, like pregnant ladies, so baby head has to pass through it. So it needs a space. So that's the logic behind it. So now we will be studying this. It's ilium. And after that, it is, this one is, it is arbitrary foramen. And after that, this is a pubis. So you can just tell me the bones of the hip. It is also called hip bone. This one is ilium, pubis, and after that, this is arbitrary foramen. So you know this about the hip bone. You have learned now. It is very simple. There are so less bones here. After that, we are just doing about the bones in our legs. This one is femur. It is the longest bone, you know. After that, this is patella. It is also known as knee joint. It's a patella. So like when we move our body, so this is the one which helps. After that, it is tibia and fibula. And this is calcaneus heel, like heel here. And these are the carpals, metacarpals. And after that, these are the phalanges. So we have to remember, you know this, which is the longest bone in our body? This is this bone. Which is this bone? You know, it is very easy. This is femur. After that, tibia and fibula, they are here. And this is heel. It is also called heel. So it is calcaneus bone. After that, it is carpal, then metacarpal and phalanges. These are the phalanges. So let's review from here again. It is, can you tell me? It starts with I letter, ilium. After that, pubis. And this one, anyone can tell me? It starts with O letter. It is arbitrate foramen. And after that, you all know, this is the longest bone in our body. It is femur. And then tibia and fibula. This is tibia and this one is fibula. And what about this? I told you, it is very easy to remember. just think, it starts with heel, and it is called calcaneus bone. And after that, carpus, metacarpus, and these are the phalanges. After that, now we come here. It is the upper extremity, arm. We always use for eating, like it always helps us. So what exactly this is? This is humerus. It is also the long bone. And this one, radius and ulna. In this one, which attached to this thumb, it is radius, and which this one attached to the lower finger, it is ulna. So it is very easy to remember. This is humerus, radius and ulna, and after that it is carpal, metacarpals and phalanges. So, like, now I am just going to discuss the posterior, the back view. In the back view, this one is the occipital bone. In the babies, it is very delicate. If the baby fall on the ground, so he can lose even memory. So we have to be very careful regarding occipital bone of the babies. After that, this one is the scapula, and this one is the shortest bone, is the coccyx. After that, I just want to review now from the beginning, like from the front, after that head to toe. So let's start. Again, we have to review so that it will be easy for you to remember it. I know you have already started learning now, but again, I just want to review from the head to toe. So let's start. This one is, which is this bone now? It's frontal. After that, nasal. This is zygomatic, maxilla, mandible, and after that, this one is collarbone or clavicle, and this one manubrium, this one sternum, or also called breastbone, and this one is xiphoid process, and these are the true ribs. Again, attached to the sternum. You have to just say, if they are attached to the sternum, it means true ribs. And these are the false ribs. And these are the floating ribs. And after that, vertebral column. And then ilium. Then pubis. And after that, this is orbicular foramen. And after that, we have to just learn about this one. This is humerus. And this one is radius and ulna. Then carpals, metacarpals and phalanges. So it's very easy to remember. I know you have learned now. Then comes, it's the longest bone, femur. Then patella. And then fibula, tibia, fibula. Then tarsal, metatarsal and phalanges. And this is calcaneus heel. So, I hope by this time you might have learned at least some bones, not all. I know it's very difficult for everyone to remember each and every bone in detail. But today we have just learned the main bones from head to toe. So, I hope it's easy now. That's it.